If I were to ask you what is caffeine, would you say that it's the world's most popular psychoactive drug, a central nervous system stimulant, an addictive substance, naturally occurring in different plants, or a synthetic drug that glows in the dark? All of these would be correct. When we think about the benefits of caffeine use and what it actually does in the body, we find that caffeine increases the metabolic rate. It improves endurance performance by increasing the secretion of beta endorphins. It decreases the perception of pain, so you could train longer and at higher intensity. It stimulates the contraction in skeletal muscles, so possibly you could do more reps. It increases the rate of glycogenolysis, which is glycogen breakdown in the muscles and liver. It acts as a competitive antagonist to the adenosine receptors. This means that adenosine, which tells you that you're sleepy and tired, is replaced by caffeine, which has a similar chemical construction. And it tells you that you are awake, not allowing the adenosine to touch the receptor site. Caffeine also enhances fat oxidation while inhibiting carbohydrate oxidation. So this exhibits a muscle-sparing effect of the glycogen and increases lipolysis. And also it increases coordination and focus. All of these things are important if you're a competitive athlete. When we think about the disadvantages of caffeine use, caffeine is a banned substance by the NCAA. High levels of caffeine consumption will cause gastrointestinal issues possibly, and they may impair performance, and it definitely impacts the central nervous system. Side effects include mental confusion, gastric irritant, overstimulation, anxiety, and addiction, and the withdrawal symptoms include headache to depression to insomnia. When we think about caffeine consumption, we also have to consider that scientific studies show that the gene type matters. Responders versus non-responders to caffeine use. There is a gene in the body called CYFIA2. This gene is responsible for 95% of the caffeine metabolism in the body. If you are single nucleotide polymorphism, AA homozygote, that means that you are a responder. You will metabolize caffeine much more quickly in your body, and you will feel the effects of caffeine immediately. You also have enhanced cardioprotective effects against caffeine use. However, the downside is you are also predisposed to feeling the anxiety and the sleeplessness that comes along with caffeine use as well. If you are a non-responder, that means you're a CC homozygote. You will have a slower metabolism of caffeine. You may not even feel the effects of caffeine at all. You, however, will also not have the propensity for some of the adverse side effects of caffeine. Also, environmental factors can affect caffeine metabolization. So that would be smoking, menstruation, birth control pills, intake of your fruits and vegetables. All of that can affect your caffeine metabolism. When we think about the considerations for ergogenic caffeine use by the NCAA, we have to think about the time and the amount. So the NCAA suggests that the amount of caffeine consumption should be about 2 to 6 milligrams per kilo of body weight. And the timing is important as well. So they suggest consuming the caffeine 1 hour before your training or competition. And if it lasts longer than 2 hours, then perhaps you can top off with another 80 to 120 milligrams of caffeine. We see a lot of caffeine use in open water endurance swimmers. So caffeine is definitely an important component for their competition. The form of caffeine you consume is also important. So energy bars, gels, and medication are good simply because they can give you a precise amount of caffeine that you're consuming. But if you consume tea or coffee, the amounts are not precise. You must read the labels and the ingredients to know what is in your product, what kind of caffeine, and if caffeine is also conjoined with other substances that may be specifically banned by the NCAA, and also combinations of caffeine and these substances may be injurious to your health. Food first. Please consume a nutritious diet. Do not use caffeine as a replacement for nutrition or recovery. Usual habits. If you are a regular caffeine consumer, you may not be able to expect that caffeine will have the same effects as it would on someone who is not a regular consumer of caffeine or someone who abstains and then uses caffeine prior to training or competition. Finally, individual variability does matter. We talked about that in the gene type. When we continue on, we look at the NCAA, what they ban. They definitely ban stimulants. Caffeine is considered a stimulant. NCAA nutritional dietary supplements, they suggest you take them at your own risk. And if you do have a positive drug test, you will lose your eligibility to participate. So you need to be mindful that dietary supplements, vitamins and minerals can contain caffeine, and definitely diet pills contain caffeine. And it is an unregulated amount of caffeine in diet pills. This is important because if you're in a sport in which you have to monitor your weight class, then you will need to be mindful of what you are consuming to help you get to that weight. What's the caffeine content? Know what the varied amounts of caffeine are, from brewed coffee to decaffeinated coffee. And finally, how much caffeine should you take? So the NCAA suggests 200 to 300 milligrams, which is about 2 cups of coffee, as a safe and effective dose, while 100 milligrams is enough of a dose to get you addicted to caffeine. Further, less than 3 milligrams of caffeine per kilo of body weight has no difference than 6 milligrams per kilo of weight. There have been studies done that show that actually 6 to 9 milligrams of caffeine may even be impairing your performance and show really no difference to 2 to 3 milligrams of the suggested dosage. Take caution, additional considerations. Remember that diet pills do have caffeine, so check the ingredients. Watch out for dehydration, especially if you train in a hot climate. Know that caffeine consumption will affect thermoregulation. Synthetic versus natural caffeine. This is super important. Synthetic caffeine is much cheaper to produce than acquiring natural sources of caffeine. Synthetic caffeine can be made in a lab with ammonia and harsh chemicals and actually comes out glowing in the dark after it's processed. Synthetic caffeine can be found in soda pops and energy drinks and junky foods. While natural caffeine has antioxidant properties, synthetic caffeine does not. Also, synthetic caffeine will be responsible for a quick spike and a quick crash, a hard crash, after the caffeine wears off. Natural caffeine has different synergists and alkaloids which help it metabolize in the body and give you that nice lift and that soft landing after the caffeine wears down. Remember that it's not okay to use caffeine as an alternative for fueling and recovery, and that more caffeine doesn't mean that it's necessarily better for your training. In the end, you're going to have to understand how caffeine affects your body by simply experimenting on yourself. Hopefully experimenting with different forms of caffeine and timing in trainings and prior to competition. Consume caffeine responsibly and take advantage of this highly effective and yet safe ergogenic substance. The other side benefit is that it tastes amazing. Enjoy your coffee or your caffeine.